Hi everyone, it is Friday, April the 24th, and it's been almost a month since we have been closed and not seeing patients, and I just thought I'd give everybody an update on what's going on. And so, unfortunately, we're still in a state of lockdown here in Maryland, and it's really sad that we're still at home for us because we love seeing patients in the office, and this is all going to pass, and we'll be seeing patients at Potomac Medical Aesthetics soon. But until then, we are trying to keep busy and doing what we can to stay busy with teleconsultations and skincare and medical consults that we're doing. But today, Governor Hogan gave another conference, and what they're looking at right now are the key numbers that are being followed for the epidemic, which are rates of hospitalization and ICU admissions, and they're not plateauing yet. And so there's no definite decline in those rates. And those are some pretty key numbers that everybody is looking at to really determine when things are going to start getting back to a little bit of closer to normal. So another rate that a lot of people will look at in trying to make decisions are also the rate of deaths. And so when there's somewhat of a consensus that after you see these rates, these key rates plateauing for about 14 days, then there will be possibly the opportunity to start lifting some restrictions slowly. Usually that will occur within around 30 to 45 days. And so until we see that plateau, it's not clear when that may happen, but we've definitely got the luxury of having other states and other countries that have been more progressed in this infection to get a better idea. And so typically after the plateau occurs, usually that's somewhere at the 30 to 45 day mark. My guess is somewhere around mid to late April is when, mid to late May, not April. I'm prepared for maybe things going a little bit longer, but certainly a lot of that is also going to be highly variable too across the state in areas that are more severely hit, such as Montgomery County and Prince George's County, versus lesser hit areas. But once they start seeing the plateaus in certain areas, I suspect that they're going to allow slow lifting of restrictions. Stage one, according to Governor Hogan, is going to be lifting restrictions on things like elective surgeries, which, although he didn't mention businesses like ours, it might be in that possibility. And after that lifting of restrictions, there is going to be a very close watch on how things progress to make sure there's not a sudden resurgence. During that time, there's still going to be a lot of emphasis on social distancing and a lot of the same measures that we're seeing today. So when we do open up, there's definitely going to be implementation of different type of things than we're used to. We're not going to be shaking hands and hugging people like we used to, but we're going to be following all the guidelines. And those guidelines, from what I can discern, is definitely going to be masks and gloves for both providers as well as patients coming through, and screening for recent illness and recent exposure. It may make some of our procedures very difficult, such as doing filler and work around the mouth, but we'll do the best we can. So the good news that we're seeing is that we're starting to get some stabilization of some of these key criteria. And interestingly, yesterday in New York State, they showed that they were doing random testing of people that had never had symptoms, and finding that there was a much higher rate of positive antibodies indicating that people had been exposed to the illness without even having symptoms, as high as 22% in New York City of people who never really had the illness, which could indicate that people have a much more common type of illness, which is very mild or not even significant at all, which may accelerate the rate of immunity in a larger segment of the population, which might accelerate how quickly we can move forward in getting back life to normal. So that's some good news. When we do reopen, we will certainly email everybody. We'll probably put it on Instagram and email, kind of like how we're thinking about things. But certainly it's not going to be business as usual. It's definitely going to be a slow return to business. We will be, again, complying with everything that's recommended to both disinfect the practice and to keep both our staff and our patients as safe as possible. In the meantime, I think the only thing as a physician that I would recommend for everybody in the practice. This is what I'm doing with myself and my family, is hanging out at home, spending time with family, and avoiding places that have a lot of people, such as supermarkets, unless we really need to go. We're certainly capitalizing on home delivery and recognizing that there are some things that we still can't find, but staying out of harm's way. And when we do go out, definitely wearing a mask and gloves. And the important thing is, when you touch everything with those gloves, don't touch your face with the gloves. Take the gloves off and make sure that you've got clean hands when you get back into your personal space. We're not booking anything just yet until about mid-June. We just want to make sure that we're not overbooking too early, because it could be a little challenging. In the event that we open sooner than that, we will definitely let everybody know that we have appointments earlier. But just to be conservative, we're staying in mid-June. In the meantime, if anybody has any medical issues that they need help with, I'm always available to do consultations. And I always want to know if there's anything that we can help you out with, whether it be cosmetic consultations, like our traditional stuff, as well as any skincare. We're doing consultations still. They can be a little challenging over the internet, but certainly we do the best we can. And if there's any medical issues that I can help you with, I want you to reach out. So we're so looking forward to reopening and seeing everybody again. And in the meantime, we hope that everyone is staying healthy and enjoying a little bit of downtime, but we want to see everybody again really soon. Please call us, and we look forward to having everybody back in the office again. All right, guys, have a great weekend. Thank you.